You may be considering a smartphone for a holiday gift for your kiddo, but new research shows increased health risks depending on their age, plus an added health benefit from a common vaccine, and the pros and cons of popular weight loss drugs, all in tonight's Health Watch. A drug that helps people lose weight now has a slimmer price tag. Ely Lilly announced today that Zepbound will cost less for those who buy it straight from the drug maker. The cuts range from $50 to $100. Company officials say this move will help fight, quote, cost and coverage barriers. This comes a couple weeks after Novo Nordisk announced price cuts for Wegovy and Ozempic. The World Health Organization has new guidelines on popular GLP-1 weight loss drugs. The Organization of Health Experts says GLP-1 therapies are effective, but there's limited long-term data on the medication, and there are cost barriers that keep them from being an option for many people, at least right now. The WHO recommends using the drugs with behavioral therapy to maximize and sustain weight loss. The RSV vaccine may have an added benefit. Experts say it can help protect kids from asthma. A study in Denmark found that RSV, a common respiratory virus primarily affecting infants, is linked to asthma. But infants who received the RSV vaccine had a lower likelihood of developing asthma. Doctors say this is more evidence that parents should consider the vaccine for their child. Obesity in childhood is linked to heart disease later in life, but that risk can be reversed. A study in Sweden found that if children with obesity lose weight before adulthood, their risk for coronary disease later in life lowers. The study underscores the importance of addressing obesity in children before it affects their long-term health. And new research published in the journal Pediatrics suggests having a smartphone before the age of 12 could increase the risk of depression, obesity, and insufficient sleep. The study looked at data from more than 10,000 children. Researchers say there could be several reasons for their findings. More time on a smartphone could mean less time for movement and activities that benefit mental health. You know, researchers do add smartphones can play a role in social connections, learning, and safety, providing a child's location for parents. So balancing the positive and negative is key. For a closer look, go to the feature section of our website, 2news.com, and click on the Health Watch icon.